everyone. My name is Jennifer Foltz, and I am the Community Engagement Coordinator with Mid Ohio Psychological Services, or MOPS. We are meeting today for our prenatal and postpartum care for parents parent pep talk. Thank you, Kelly, for meeting with me today.
Thank you so much for having me. This is one of my favorite topics, so I'm really happy to be here with you.
Awesome. Well, let's just jump right into it. What can you tell us about prenatal care for parents?
Yeah, absolutely. So, prenatal care, it refers to that period of time during the pregnancy when the birthing parent is taking care of themselves and meeting their needs to be able to prepare for delivery and postpartum. So, prenatal care takes on a bunch of different domains. We want to make sure that the birthing parent is taking care of themselves physically. So, prenatal care in terms of going to doctor's appointments, making sure that you're taking your vitamins as prescribed, making sure you're meeting your nutritional needs. And then, of course, the least favorite part that I have is when people say, "You'll miss your sleep." So getting your sleep, right? We hear you're going to lose so much sleep when the baby gets here. So making sure you get a good restful sleep. Um, so all of your physical needs are being met, and then also making sure that you are being socially connected, meeting your social needs during the pregnancy. So prenatal care is self-care, making sure you have people that you can trust, not just your providers, but trust in your provider is essential. But also friends, family, maintaining contact with people and making sure that you are not isolating yourself because pregnancy can be such an isolating experience. And so, what we want to do is really address those things before they become problems. And that's the prenatal part of it. Making sure that we put all of these things in place so that they don't become problematic later on.
Absolutely. And that's such great information. And, I feel like I've heard the sleep. I've heard of course, like go to your doctor's appointments, eat healthy. But one I don't really hear a lot is making sure that you stay connected to other people and making sure you have those social supports because I think that, that can affect your mental health and, obviously your overall health with that.
Yeah, and that's a great point. I think that what people tend to forget is that our emotional health doesn't exist in a box. It is so
Mhm.
connected to all of these other things. So when one of them starts to backslide, whether it's our physical health, because we're not meeting our basic needs, or because something might come up during pregnancy, it is not uncommon to have some medical things come up, whether it's with blood pressure, with blood sugar. Um, we don't always talk about how our emotional health is affected by those things. And socially, emotionally, we are just creatures who need to have that connectedness. And when we don't, it can really affect us. All of these things really interact with each other. So we want to make sure that our emotional needs are being met, our social needs are being met, and our physical needs are being met because they all are so closely related to each other.
Absolutely. See, that is such great information. So what can you tell us about postpartum care for parents?
Yep, absolutely. So postpartum looks a lot like prenatal care. Definitely making sure that you are completing those follow-up visits with your provider as they recommend for you, and also making sure that you have your social network built up. Um, it can be really isolating and really lonely having a new person to take care of and losing out on all of that sleep. So making sure that you are meeting your own basic needs and then having people you can reach out to and connect with. So that way you can normalize the experience. There are so many unknowns between what to expect, like why should my baby be doing this, or when should my baby be doing this, or what does this mean? It's really confusing. And having people who have been there or going through similar situations can help to take a little bit of that edge off. So, definitely keeping those social supports in place and asking for help when you need it, whether it's please take the baby for 5 minutes so I can take a shower or so I can eat something, um, or asking for someone to come and help with laundry for a little bit. Just remembering that you are physically healing, you are
Mhm.
emotionally going through a lot. Hormones plummet. It is actually one of the sharpest drops in hormones that a person's body will ever experience immediately after giving birth. So there is a tremendous amount of stress that's put on your body during that time, and you deserve a lot of support and grace to be able to navigate it in a way that feels comfortable.
Absolutely. So, how do you think the experience differs for the birth parent versus the support parent?
That's a great question. And even though the partner in that situation is not having the same physiological healing and response that the birthing parent is, there's still a lot of stress there. Um, and it's
Mhm.
actually not uncommon for the support parent or the partner to experience significant distress and anxiety in trying to support not only this person that they love and care about, and also this brand new human all at the same time. So it's important and vital for them to also meet their own basic needs and have their own support system in place because we don't get a handbook about how to help somebody who just gave birth. We don't get a handbook on how to balance the financial responsibilities going to work and coming home and taking care of two more people. So, having people who understand what you're going through to normalize the experience, and then making sure that you're also reaching out and not isolating because just like for a birthing parent, we need to be able to know that what we're going through is normal. And when it's not, I need to know that I have somebody that I can count on to support me through it too.
Absolutely. And I think you bring up such an important part because obviously the birth parent is going through so many changes, but so is the support parent. And I think that is an important distinction to make. So, what are some things to look out for that you think exceed what they call the baby blues?
Yeah, absolutely. And it's really, I guess, normalizing first the fact that the emotional ups and downs during pregnancy and postpartum are super normal for the whole family, especially with that big hormone drop right after delivery. Um, and then taking care of a baby. It's normal to feel tired, to feel overwhelmed. And for many people, it's even normal to have some of those unwanted or intrusive thoughts afterwards. Self doubt tends to creep in, worries about being able to care for a brand new human. Those can be really normal, albeit very uncomfortable. Um, so, making sure that you're sleeping, eating, showering, asking for help, having those basic needs to keep things from feeling too heavy. Um, and those first 2 weeks postpartum, it's really normal to have those baby blues. And usually those feelings will resolve within the first 2 weeks of delivery. And so, if you're noticing that those moods are lasting longer than 2 weeks, or if it's causing significant distress, if it's making it really hard for you to take care of yourself, to take care of your baby, that would be the time that you might want to reach out to a provider because it could be a sign of a postpartum mood disorder like postpartum anxiety or postpartum depression. Um, and these are a lot more common than I think people tend to realize. About 15 to 20% of birthing parents and 10 to 15% of birthing partners experience a mood disorder during pregnancy and within the first 12
Wow.
months postpartum. So it's much more common than people tend to realize. Um, but there is help out there, and a lot of people will find some relief, whether it's from engaging with a counselor or medication, a combination of the two. You don't have to suffer alone. Just knowing what to look out for and then accessing those resources is so important.
Absolutely. And I really like how you address the fact that, certain parts of the baby blues to a certain extent are normal. Most women most people will go through it. So I really like that, you mentioned that, and just the mental health concerns of it all. I think all your questions, we're going around the same stuff, self-care, take care of your mind, take care of your body. And I like how you're working to really reduce that stigma that's associated with getting help.
Yeah, I mean, it has been a long time coming to normalize this experience, and parents have felt a lot of shame and embarrassment for some of those heavier thoughts. And it really is an experience that so many people share. And it can be scary reaching out and asking for help from a provider if we're feeling shamed, if we're feeling embarrassed. And so recognizing, like, hey, if 1 in 5 moms is going through this, 1 in 5 birthing parents, 1 in like 6 dads or birth partners is going through this, there's a good chance my doctor has already heard this, probably today.
Absolutely.
And so they're not going to be surprised. If anything, it's just going to be an opportunity for me to find support because I don't have to suffer alone.
Absolutely. And that is such a great point you made. So thank you so much for saying that. And thank you so much for being willing to talk to me today about prenatal and postpartum care for parents. I think it is definitely important. And talking to you, I can tell that you're passionate about it, and that you think it is really important enough to discuss.
Definitely. And if anyone has any questions or wants additional resources, Ohio has the perinatal outreach and encouragement for moms and birthing parents poem through Mental Health America. They have tons of resources, including support groups. They have a mentor program. Postpartum Support International has some great resources for birthing parents, partners, families. So there is tons of resources out there if you want to investigate a little bit more, or if you feel like you might benefit from some additional support. So definitely not alone. And I'm so glad that I've had the opportunity to talk and put some of that information out there for the people who are hoping to hear it.
Well, thank you so much. And a big thank you to the Columbus Foundation, whose grant funding made this parent education series possible.